Hi, I'm Dr. Gary Glick, the founder and Chief Medical Officer of Healthcare Advocates International here in Stratford, Connecticut. Our main mission is to fight stigma and discrimination for those in the underserved communities, especially those that are part of the LGBT community and those that are HIV positive and HIV at risk. So let's go over a couple of those main points that I bring up. First, we've created a campaign known as Stigma Warriors. As I said, our main goal is to fight stigma and discrimination associated with the LGBT community, because the LGBT community is at higher risk of becoming HIV positive. And we now know that if you're not HIV positive, you can prevent HIV infection 100% of the time by taking something known as PrEP, pre-exposure prophylaxis. Pre-exposure prophylaxis. So we now have available to us a prevention in multiple forms that can help you protect yourself against becoming HIV positive. It's known as PrEP, or pre-exposure prophylaxis. It comes in many forms, pills and injections. We have to just determine which method is right for you, and if you take your PrEP the way it's prescribed, you will have a 100% chance of preventing yourself from ever becoming HIV positive. We are now at this point, 40 years later into the HIV epidemic, where we know that if you find out you're HIV positive, you can live a normal life expectancy with no major medical problems related to HIV. And we know that if you take your HIV pills as prescribed, you will become undetectable. What that means is when we draw a blood test, we will not be able to find any HIV detected in your blood. And you know what? When you become HIV undetectable, you become HIV untransmissible. What that means is undetectable means untransmittable. You will no longer be at risk for infecting your HIV negative partners if you choose to have sex without a condom. So I want to give another shout out to Ballroom We Care, because here at Healthcare Advocates International, we have pretty much the same mission as you guys do. We're working with our communities that are really at high risk for becoming HIV positive and want to do that prevention. We're working with our communities that undergo a lot of stigma and discrimination. And in our community, we deal with a lot of substance use, what we call recreational drug use, that leads to our increased risk for becoming HIV positive. So we're really trying to fight substance use by increasing your ability to love yourself. It is really important to have a good self-esteem, to approach life in a real positive way, and we all together work with people to help you build that self-esteem, build that love, that self-love that is really important, so that you're not necessarily out there practicing sexual practices that might put you at risk for HIV. That's how we beat the HIV epidemic.